Now, the Secretary of State for Health, he wasn't called that, he was Minister for Health, when the NHS came into being, had certain duties about ensuring care was provided to all. There was access to care. There was equality of care, equality of access to care. And I just want to refer to something now which I've got to read. And this is quite frightening to me. The very first NHS Act in 1948, it said, "It shall be the duty of the Minister of Health to promote the establishment in England and Wales of a comprehensive health service." Now, in 2006, the Labour government put in an NHS Act, and it said there, the Secretary of State must, for that purpose, provide or secure the provision of services in accordance with this Act. So the first one said duty, the second one in 2006 said must. I say second one that I'm quoting, there have been many NHS Acts over the years. The new Health and Social Care Bill says, Section 1 of the National Health Service Act 2006 is amended. Substitute, the Secretary of State must act with a view to securing the provision of services. Now, civil servants do not put wording in legislation in a haphazard manner. They do it deliberately. They have actually handed over the decision-making about what is suitable care provision to the GP consortia, who have already said are totally unaccountable, and may in fact actually be private healthcare companies who are going to offer these services. There's further nothing in the legislation, and I await eagerly to see what amendments are going to come in from the government and others after this pause, this listening exercise that they're talking about. There's absolutely nothing in the legislation that says the GP consortia and or a private company that they're employing or forming to do this commissioning can't also provide the same service they're going to commission. In other words, the GP consortia could quite legitimately, although in my view immorally and unethically, commission healthcare provision from a private company that they part own. Now, I put it to you, I'm not saying that this is going to happen, but as long as the legislation allows that possibility, I'm a cynic enough in my advanced years now to realise that somebody somewhere will take advantage of that. And I think it's imperative that we act to apply pressure to the government to ensure that loopholes such as that are not allowed to carry on in the legislation. One of the other things in the legislation is that there's a cap currently on foundation trusts' income that they can obtain from private patients. Now, I work for a foundation trust. Not every hospital is in a foundation trust, but part of the legislation says that every hospital, every provider of care will become a foundation trust. Now, the cap that the last Labour government put on the income from private care was there to say, let's make sure that the NHS patients get a fair whack at the services that are provided. Now, that cap's been removed. Now, my trust, which is called the Calderdale and Huddersfield NHS Foundation Trust, is facing very tight financial budget restrictions, as are every NHS trust in the country. There's actually a financial context that we're looking at here with 20 billion cuts, which is a 4% year-on-year cut over the next 3 years. Now, that's a major impact on our services. But what this actually means is that my foundation trust, which is not really NHS, it's off balance sheet, it can do a lot of things as long as the consortia and the guidance rules in terms of quality provision apply, can actually decide that we're going to up this. We can bring in more private patients and therefore increase our income to offset the budget cuts that the government's placing on us. Now, whenever they do that, that means that this capacity we have in the hospital, if it's diverted to doing private care for people who are prepared to pay the money, which is those, of course, who have the means to pay the money, as opposed to every one of us who is supposed to get a free, full service, that means that our service is going to diminish. It must do. There's only too many slices you can get out of a cake. And that's one thing, again, which is indicative of how the situation is, and it's very, very poor. All hospitals have to become foundation trusts. All foundation trusts are monitored or regulated, used the wrong word there, by an organisation called Monitor. Monitor's prime responsibility, according to the legislation, is to maximise competition in the healthcare provision sector. Now, I'm not in favour, necessarily, of competition being the wonderful thing that a lot of people who have that sort of view of economics believe. I think it might work well in, say, a market stall when you're buying a cauliflower from that stall at 20 pence cheaper than that one. But healthcare is not a commodity to me. It's not a Tesco or Sainsbury's run, pile them up high, sell them low commodity. It's something which is essential for every single one of us to have a healthy life and to help us then provide for the country and make the country wealthy in that way. It's not something to be bought and sold. But Monitor's role is to promote, maximise competition. How's time just now? Sorry.
I was just writing 2 or 3 minutes.
Right, okay, thanks very much. Another aspect of financial impact on us is that this local hospital, the Calderdale Royal Hospital, which I work at as well as Huddersfield Royal Infirmary, but this particular hospital is a PFI hospital, Private Finance Initiative. It still has 19 years of that PFI contract to go. Now last year, my local trust closed Ward 11 at HRI, and I was just told last week we're going to close Ward 17 at HRI. And I can assure you there are going to be more closures coming on, not just because of financial restrictions, but there's quite a good, sensible move out of acute care in the hospitals out to community care settings, and I can accept that, and that's fine. But when this local trust is deciding what wards to cut down, they're not going to cut down the Calderdale Royal wards, because that's on a PFI contract, and they are mandated under a commercial contract to pay the management fees and facility fees, which makes the company, by the way, that created that, an extremely wealthy company, for the next 19 years. So I know where the pressure is going to fall down in terms of the local hospital trust. It's going to fall down on HRI. And I can foresee a time in the future when the accident and emergency unit at HRI might close down. And we might all have to come to Calderdale to get emergency care. And that, again, is not a good thing. But what can we do about it? I echo what everybody said. We've got to apply pressure. And we can't do that as individuals. Write letters to the press. I'm really concerned and perturbed at the fact that the coverage of this white paper and now the legislation has been analysed insufficiently by the general press. It seems to be a done deal. There's been no pilot, and there is no real evidence to show that the ideas encapsulated in the bill will bring about the improvements that Bob was mentioning we need to aim for. None whatsoever. And yet they're going ahead, step by step by step. Something like 85% of the country now has Pathfinder GP consortia being set up. It doesn't mean the GPs are in favour, it means they've got to step in to be prepared to take this on should the legislation go through. But they're being allowed to do this without piloting, without evidence, and they're just doing it as though the democratic process in this country does not apply. I believe we can defeat much of this bill. I believe much of it can be amended strongly, and I look to your support to do that. Write to your MPs, write to the press, speak to your friends, family and neighbours, because what we are facing ultimately could be the destruction and the end of the NHS, and that's the last thing any of us want to see. Thank you.